Thank you very much for being here today. I welcome you all, and I want to welcome everyone in this session about psychosocial risk management at the UN, translating the UN 2.0 vision into action. My name is Luis Torres, and I am with my colleague, which I'm not going to say his name because I don't speak French. So please, Guillaume.
So nice to meet you. My name is Guillaume Després.
So, and with us, we have three presentations today in this afternoon. We are going to start with leveraging data and engagement to manage psychosocial risks, UNHCR experience, and we have here with us our speaker, Dubravka Suzic, also known as Duda. Probably most of you know her as Duda, head of psychosocial wellbeing, and Linda Andersson. Linda is online, right? Okay. So, and Linda Andersson, who is online today, Senior Project Manager, also at UNHCR. So.
Thank you very much. And I would also just like to add, if you allow me, with us today is also our colleague, Zaina Dirani, RSD Officer in UNHCR in Jordan, the operation that actually took part in the pilot, and Zaina was part of the action group that took the results further in the middle of a very, very complex situation. So we will talk, and she will talk a little bit later about her experience. But so I have this, and I'm supposed to do something with that, and I guess it's maybe the front page. I wanted to give a shout to my colleagues because Linda has really been critical in driving this project for the past couple of years. Has been extremely detailed project in a sense that we really wanted to explore how it could fit within UNHCR. So it's not something that we have taken for granted, we have consulted. And that's another thing that I hear in this audience, a number of people that supported us in the consultation process from whom we have been learning endlessly. In that, I do want to give acknowledgements to the government of Germany. Kati has already mentioned, but literally without support, we couldn't have done that. Our innovation section as well has supported our work on data innovation. So that has also already been a part of this integrated approach, if you wish. So that you are not alone in the organization developing this. And that was really kind of symbolic sign, but extremely important. So thinking along, already sowing the seeds in some other parts of the organization. The collaboration with the European Academy, I sound now like a promotion, this is a pub, 2 seconds, but has been fun, actually. And I need to really thank the colleagues for their patience, as Marta Helena said before, but also, for a number of hours that were beyond and above the agreement that you have had. So you have supported our learning curve, and that was extremely important. Colleagues in the UNSCG, when we ran consultations, we asked everybody interested to come and join us, to literally kind of help us think, how do we do that? And having that privilege to work together and, sort of being challenged on the different views or stances that we were kind of thinking, we changed quite a lot as well as a result of that process. So that is something also that I want to say, really thank you. And finally, the mental health strategy of the UN. Them putting this on the board has actually really advanced the work in this area. I've been working in the staff counseling, psychosocial well-being within the UN, in UNHCR, for over 20 years. We have been doing a number of different programs, etc. But once that UN actually put the bigger, if you want, chapeau over the whole area of work, it created a different sense of urgency. And I really want to emphasize that. So with that, maybe just to move on and to say that, of course, psychosocial risk management project is our story for last couple of years. But psychosocial risk management, in a way, we have been doing before, in our own way. of course, we would go into operations, see, okay, what is actually source of your stress here? What is going on? So you kind of assess as you know, as you can, and so on and so forth. So the idea has been there, but it has taken us a long time to come to the point where we really can work on development of scalable and sustainable and data-informed approach to managing psychosocial risks. And that is actually interesting. That was a little bit of a question that I had earlier on, and I thought, okay, we have 2 days to debate that. Why has it taken such a long time? But with this project, we wanted to develop a streamlined assessment that is automated, user-friendly, that doesn't take, investment into consultancies, etc., to calculate different, values and so on. And that automation has been extremely important. We also wanted to have a system that is integrated in the organization. So it's not just standalone method. So we have worked, and I will tell you later what we are doing with the enterprise risk management, how psychosocial risk is actually part of occupational health safety risks, which is a part of enterprise risk management. The end of story, in a way. But it's actually only the beginning. We wanted to also have something that creates participation and engagement of all the stakeholders, and particularly people of whom we are talking about. So it's not doing something on people, but actually engaging with them as well to change the situation. Fostering collaboration with other stakeholders was extremely important for us, so making sure that we bring on board different people-facing roles. So in UNHCR, that would be anything from the ombuds, the change management, Daphne is here with us, the ethics office, human resources colleagues, training, learning and development colleagues, internal communications, security. I'm kind of like, who am I missing? It's really the matter of a broad group of people. And that is actually what I think is really the key on which we are going to continue working. We are still at the beginning, but we will continue working on making sure that this approach is not just the approach of the unit that I lead. And finally, Kati talked a lot about data-driven decision-making. And of course, this is something that with this we have, I think, achieved. It's fascinating to see it. And I would actually now like to show you, if I manage to show, can we get to the dashboard? If not, I will show you the screenshots, but it's more fun to show how it works in. So what you will see now is dashboard, which is a result of collected data through the psychosocial risk assessment, calculated data. Luis did the code, which is doing some magic all over. And you will see how we have actually organized that data in the dashboards that are, yeah, we can. Okay, so it is. So this is the kind of global page. Maybe if you could show us the one of the page with results, the locations, maybe. It is, so here on this page, you can see, I would say, 4 elements that are important. One is the psychosocial risk index. We have wanted to have one number that we can add to the strategic risk register. So it's also a good kind of indication of overall temperature of the working environment, just as a general lead. Below that, you can see these blue lines, which are prioritized risks by the size of the impact. Then you have on those red, they are red, they are not green because the risks are actually quite high. The numbers, indicators of the impact. So you can see the impact for different outcomes. We have organizational outcomes, we have work engagement, job satisfaction. We have put there also sick leave, longer sick leave. Then on the mental health outcomes, we have measured depression, burnout, anxiety, and stress, and other general health outcomes. We have looked into vicarious trauma, general health, alcohol use. So these are sort of those that we have chosen. Here we could have put anything, more or less, but it is actually something that we are starting with. The numbers indicate the percentage, the likelihood of negative impact in case nothing is done about the psychosocial risks. So that already is actually quite interesting. Now, the last point is that if you scroll over those boxes, red boxes, I will have the information about the prevalence. And that is actually something that we need to spend quite a lot of time educating people around, because you see the percentage, everybody says, okay, 47% of people are disengaged. No, but they will be disengaged if you do nothing about the psychosocial risks. Prevalence data is something that we are typically asked in audits and so on and so forth. So for that reason, this is also something that is extremely useful. Maybe if we could just go to the action page, because we wanted to make this tool also not just statistical tool, but also something that can support colleagues in the process of using, in the process of action planning, etc. So on this page, you can see that, for example, with any of these particular risks, you can actually see a drop-down menu of suggested actions collected from the research. Our ambition is going forward that this would also be populated by evaluated good practice examples that we will collect across the UN eventually, etc., etc. This is meant to really be serving to the action groups as the inspiration for their conversations, starting point to think what could actually help us going further. And here, of course, we have this reference to the UNHCR document. ILO is just doing the audit. So this is what we have done, and also a living document that has to change, but it indicates basically what UNHCR has in place that could help with any particular risk. So that is interventions by different stakeholders and so on and so forth. Again, helping the action group to actually focus on what is that they can include in their planning. Well, we have, maybe just for the sake of time, maybe we just quickly show the page with the guidance material, because that is also, okay, this is the page I call, okay, thank you. The page with guidance materials and theoretical information. Again, it's something, I'm showing this really just to say that we are trying to make a tool for users, something that will be useful for them. So the idea is to find everything in the same place. So much also the guidance, the documentation, some information about the theory of psychosocial risk management is there too. And maybe just the last one, that is the page for the nerds. When people are asking, okay, so what questions are you asking about depression, or what questions are you asking about career development, etc., as a psychosocial risk, they can find that information there. So this is our dashboard. We can filter the information. This particular one is based on the pilot study we did last year with 15 operations. We got over 1,600 responses, which were used to train the machine and to do the magic, according to Luis. But and it is filterable for different categories, so location, job category, some demographic data, etc. everybody has the access to it. We had debates. How do we present? Is there actually what is pro and con in terms of making everybody access the information? But finally, we decided that this is what we want with this is not to create some kind of stigmatic tool. We wanted really this to become the tool that educates, the tool that inspires, the tool that actually is really source of information. And you know, if I see as a representative in one country that somebody else is doing better on particular risk, then I may actually get to call and say, hey, what are you doing? What's working for you? You know, sort of, I have this kind of thing. Of course, we will have to do quite a lot of work around this to make this happen. So maybe just next slide is with me to go on or not. We have a little dance. Just to talk about principle of application. Collecting data and calculating is just one part. It's a very fascinating part, particularly when you see it in the dashboards. But actually making sure that there is something done with that, this is where we wanted to actually see what is that we do. So here we are. So first of all, we are integrating this in the enterprise risk management's annual risk review. That is the exercise that each operation has to do. Usually it is towards the end of the year. You are looking into the risks that will be relevant for your operation in the following year. And based on that also you plan your resources and action and so on and so forth. We will be encouraging that operations do it once in 2 years. That is how we are starting. We are not mandatorily asking them to do it yet, because we really want them to come to the point where they feel comfortable with the process and when they actually do get engaged in the process rather than doing it because they have to do it. So that is the idea so far. We also want it to be used at the operational level. So, you know, for us, we really learned a lot from WFP on that because in the past, we did have global staff surveys that to a degree, you know, did different measures, etc., but still looked into work environment and people's experiences around this. You get results for the whole world, then they are filtered by the country, then I don't know what, and so on and so forth, but you have very low response rate. And then you also don't necessarily, you cannot follow up with everybody. It becomes kind of a motion and the need to do it rather than wanting to do it. The engagement with that is much lower. So we decided that this would not be done. This is not a questionnaire that will be done for everybody at the same time, but it will be released to the operations that identify the risks, the psychosocial risk in their annual planning. So that is the idea. And it will be scheduled. So it's not something that they can do, the operations can do anytime they like. We wanted to do it. We are not yet in the capacity when we can, but it's going to be happening in January. We just decided yesterday. So on the process side, okay, I hope you can see. Following the announcement, so next week, this enterprise risk management will be released. The announcement will come out. And as I said already, everybody will be told you can do the measurement in January. That time in between, we will use for team preparation. So the operations that will express their interest, we will work with them to establish their action groups, to actually start understanding the process a little bit more and to really get ready for January for the assessment. So when the assessment takes place and they get the results, they're already prepped to do the follow-up. The risk calculation, etc., this is really for me to remind that is the code that does the whole thing. But the discussions that are happening within the operations, this is actually what is really important to us. We will have Zaina in a second to talk a little bit more how they did it in Jordan and under which circumstances, but that is actually where we need to do quite a bit more engagement. And for me, this is where I look at this tool like an engagement tool, which is a little bit contradictory because we are doing psychosocial risk assessment. Probably the engagement is kind of as an output quite low. And here we are using this tool to engage people to work on this. And to me, that is really offering us the opportunity. So that's one thing I wanted to emphasize. So this is where we have reached so far. We are, of course, actually, let me just say that out of 15 pilot countries where we piloted where we collected the data, apart from the Jordan operation, we had few more operations that have actually started looking into this. And just most recently, the operation in Chad has spent quite significant time looking at the data. And of course, things since last October changed, but everybody can guess that job insecurity is the top negative factor. So this is kind of like something to yeah. And we have, so while the implementation of some action is going to start, is taking place now, the next stage will be how do we evaluate? How do we actually take lessons from that? And we are going to be very much looking forward for continuous collaboration around this and opening our our space for everybody who wants to talk with us. So maybe at this point, I would like to invite Zaina to just say a bit more on the experience of UNHCR in Jordan. Again, they have done the pilot testing, collected data in October, November last year, and started the use of the following up with the action planning this year in the middle of downsizing. So, Zaina, over to you.
Thank you, Duda, and hello, everyone. I'm happy to be here to speak about the Jordan operations experience. So while, maybe just to give a bit of a background on the Jordan operation, it's quite a big operation that involves a country office, 2 refugee camps, a sub office, and a field office. There's a lot of engagement, direct engagement with refugees with very large case processing units. But what is interesting about the interventions this time on mental health is, as Duda said, we've always, of course, had in mind psychosocial risks that staff face, but we've never really thought of looking at the wider staff outside of the units that usually work directly with refugees. So we've been very focused on certain risks that were very apparent. But this risk or this dashboard really showed us that actually risks are there for staff of in different functions and different capacities. And what was very interesting in this PSRM tool is that it allowed us to break down the high dimension risks, depending on function, depending on duty station, to really allow us to work with the data to analyze what are the risks and how can we address them. So what's different with this tool is that it really gave senior management an overview of the pulse of the operation. Where do we stand? What are the psychological risks? And what are the impacts? As Duda said, if left unaddressed, the risk is not only on staff themselves, but it's also on the operation, the ability to continue to serve, our productivity, our ability to be there for refugees, especially in the nature of UNHCR's work. So what we have done in Jordan is we have analyzed the data that we had received after staff filled out the survey that was shared end of last year, and we had formed an action group. This action group involved the risk focal point in the operation, the staff council, HR, the senior management, heads of offices, and a peer advisors network, which is a network that is equipped and trained by the ethics, the ombudsman, and the psychosocial well-being section to be there for colleagues. So this group met and looked at the risks that staff face, but also looked at the changes in context. And that's also what's interesting about this tool, that it's allowed us to be flexible and adaptable to look at the risks that recently, with the funding situation, with the major restructuring that took place in our operation, to really address how are staff dealing and how can we already mitigate those risks to make that process and that transition as smooth as possible. So this action group met regularly and looked at addressing those risks from different perspectives. So it was really a comprehensive approach into looking, for instance, at what HR can do to be able to address psychosocial risks when, for instance, notifying staff of certain decisions, when looking at their rights and entitlements, when sharing this information with staff. We looked at senior management. How can they be close to staff to ensure transparency and open communication, to build the trust in the process, as painful as it is. The Staff Council and the Peer Advisors Network worked on individual sessions with staff, but also on group thematic sessions to also assist staff throughout the process. We have the risk focal point who also engaged with us very proactively to make sure that this is addressed in the risk register of the operation, which again was a really major highlight in the operation, because this emphasizes that looking at mental health is actually a priority, and it's actually a shared responsibility, not only for certain managers who have high risks, apparent risks amongst their team, but really it's time to institutionalize the idea of the duty of care and the responsibility of looking at mental health for staff. So with that action group, we were able to follow up with all those interventions at different levels, from technical to larger interventions within management, to keep the dialogue ongoing. Also making sure that our treatments are being updated in the risk register, are being tracked, and we are being held accountable and are following up on our mitigation and mitigating measures. So that is in brief our experience. It has been very helpful. It had really, for the first, I don't want to say for the first time, but really mental health and addressing mental health. And it has really placed a big ownership, starting from senior management who really were driving this, and also the involvement of all colleagues, from HR to project control, risk focal points, to staff council. So we will continue, as Duda said, to use that data to take pulse of how the team is doing. And it would be interesting to see how it changes over time, what is working and what is not working, to continue the dialogue. Thank you.
Thank you. Thank you, Zaina. So just as a concluding remarks, some of the reflections that we keep on having in the process, how are we going to deliver this going forward? The kind of like, sometimes I sit back and I'm thinking, what are the capacities, what we will need, what about, but it's really one of the keywords on my mind is integration. So really making sure that this is not the tool of psychosocial well-being unit. It is an organizational tool, and this integration with enterprise risk management is the starting point. So we will keep an eye on that, and wherever we can actually do that, we will continue. I'm not going to go through all of this on the list, but just one more thing that I wanted to mention is, as we are going forward, obviously we will need to look into our policies and seeing what of the policies could support this process. That is very important. But as we are looking at the policies, I do want to say that for me, this is not just the matter of compliance. It is really the matter of changing the work culture and how we are making sure that, as in work planning, etc., the psychosocial risks are like another glove, like brushing the teeth. You don't even think about this anymore. But we are doing this the whole life because somebody taught us early on that this is important. So this is kind of like what we and where we want to reach. And as I say, we have done a lot, but I still feel we are at the beginning of the journey, and really welcoming this opportunity to share, but also to hear and to invite everybody to continue thinking together, particularly as we are looking at interventions, as we are looking at how do we support the action groups. To me, that is going to be the next critical step that we will be embarking on. So thank you. And thank you to my colleagues remotely. Thank you.
Thank you, Duda, for such an interesting experience and describing it so well. The next presenters are the presentations entitled Beyond Compliance, Ensuring Organizational Accountability for Psychosocial Risk in the UN. And our presenters are Paola Paoletti, Staff Counsellor, and Ruan Boshoff, Chief of Staff Wellbeing at the UNICEF. So thank you.
And I'm really thankful that Duda spoke about compliance last, so she gave me a great assist here. You know, across Europe, in my understanding, employers are legally required to assess and prevent psychosocial risks. The legal framework, even though it's applied unevenly, I understand, and there are differences among countries, but the standard is an occupational health policy. In the United Nations, we have a different situation because we're not bound by national labor law. We don't have an authority or an inspectorate to enforce compliance. And I think unless Lucia is coming knocking at our door, this is pretty much what we have in terms of compliance for psychosocial risk management. So our protection in this case doesn't really, it's not really based on external enforcement, but on our system of governance. This does not mean that there is no legal foundation. There is a legal foundation for our duty of care, right? It should be firmly protected by human rights law and by case law of our tribunals, a little bit of a customary case law, if you will. And of course, there are internal policy frameworks like the UN Mental Health Strategy or the UN Security Management System or the Occupational Health Framework. But all of that is uneven, exactly like in the real world. So how do we guarantee that psychosocial risks are managed within the UN without a policy framework for it? And here we are saying that our duty of care, it's possible to have it as a living, measurable form of accountability through a system like the system that Duda has shared with us. For us, it's not a matter of legal enforcement, but it's a test of institutional maturity. And in particular, of whether we hold ourselves to the same standards that we hold others accountable internally. And the UN now, it's under extraordinary pressure, and every director here, and Marta Elena mentioned that. And all the things that are happening, budget cuts, restructuring, mandate ambiguities, are psychosocial risk multipliers. I'll tell you the story of supply division, because in supply division, we wanted to manage these risks proactively. And just to situate a little bit the story of supply division, we are headquartered in Copenhagen, and supply division is the global logistic and procurement hub of UNICEF. It procures and delivers essential supplies to children, right? And also does things like market shaping and strategic procurement. Early in 2024, so before the UN80 was announced, supply division was already preparing its office management plan. We had consulted with everybody, all big consultancy firms. We were going already through major transformation. We had a functional design review. We had an operating model review. We had a financial sustainability review. And at that point, we were preparing to transform. But rather than wait for distress signal in people, like raising of sick leave and people being particularly stressed at work, we decided to manage this proactively. And we presented the project to management so early in 2024. And thanks to a visionary director, because we needed a proof of concept in UNICEF, and we didn't have one. And also from the colleagues of Staff Association and the colleagues of People and Culture helped us bringing this forward. We could start this project with the help of Aditya sitting there. Without him, none of this would have happened. We managed to have a proof of concept for supply division. We used the same instrument as UNHCR has used, with less outcomes, because outcomes like post-traumatic stress disorder, vicarious trauma were not particularly important in our particular setting. But we use practically the same methodology on a much smaller scale and in a snapshot, basically. And we have demonstrated through that this process can work even on a smaller scale. But for us, what was particularly important happened after the survey, because the results were shared transparently, first with management and with teams, and instead of a diagnostic exercise, became a conversation on how the work is organized and managed. And a lot of things came up, of course, because people were afraid of budget cuts, of what will happen to them, of merging of roles, of transformations of teams. So beyond the numbers that we have shown to people, the co-creation of action plans was what mattered really in that particular context. And this has also demonstrated that a conversation with staff and for staff matters, and particularly more so in times of change. And in all this process, our Staff Association has been included, our People and Culture colleagues have been included, so that the process, co-managed, helped rebuilding trust in a moment where supply division, because of all these changes, and you will see a timeline, UNHCR came practically in the middle. So that was even more so, more stress, more difficulties of the division while already in transformation. But we had our leadership, our knowledge and data supporting this process and not hiding from it. And this has helped us to really have an increase in the psychological safety of this process through the participation of everybody. And we use this not as a standalone thing, but as many of the colleagues already mentioned before, we already have engagement surveys. In the UN, we had things like the global staff survey. It's a measure of engagement among many other things. So when we presented this first, one of the first doubts was, well, we already have a survey. Why are we having another survey? What's the difference with the other survey? We actually did an integration of the results of the psychosocial risk assessment with the results of the global staff survey. And we did integrated action plans that then became integrated action plan for the change management process. So this was an attempt to mainstream everything that was happening, because a lot was happening, supply division clearly, at the same time. In a way that made sense and that was all going in the same direction of having staff protected through the process. And here I show you very quickly the action planning that we did from the beginning to the end. You'll see that started in 2023 already. And the first action that we took at that point was to train the managers. As some of the HR director mentioned, popularizing the concept in an environment like ours is not that easy. So when we talk about psychosocial risks, organizations hear the word risk and they already don't like it. So they imagine somebody's going to sue us, we're going to have a problem. So why are we talking about this? Why don't we talk about something a little bit more easier to deal with? But we did, within a program for managers, 7-module program for manager, we added one module specifically on management of psychosocial risks. The fact that we trained middle managers helped us to socialize the terminology and the concept a little. Then we had the support of the supply division management team, and that also helped us and supported us to socialize this concept a little. Then we went through the process of assessment, analysis, action planning, but then we needed something to sustain this process, because in a small environment like this, where a lot of things are happening, one big challenge is sustainability of a process. Many times, as I'm sure everybody who is in this room and works for the UN knows, reports are written, they're put in a drawer, nobody looks at them until we need to pick that up to report on a different report or something like that. So we needed really to sustain this process, to keep it alive. So we trained wellness advocates. We selected wellness advocates among colleagues from people and culture and staff association mainly, but also other colleagues in different centers. And they are trained not only, their peers, right, counselors, they're trained in not only mental health first aid, but they are specifically trained in the basics of psychosocial risk management. And this has helped us to have psychosocial risk management not as a one-off exercise, but as a sustainable ongoing process. So the groups at this point are still meeting. They are still looking at action planning beyond what we've done during the period where we were supported by Aditya. Now the process supports itself. People are willing to engage by themselves. They continue having the process and bringing the process forward and find ways to co-create, particularly now that after planning the transition for about a year, now we are in the time where there is a transition. So teams are merging, roles are shifting, and this is going to be for the next probably 6 months to a year. So in this moment is when this process is particularly important. And the fact that people are engaging bottom up is also particularly important. But because our colleagues are promoting so well the ownership, the supply division ownership and sustainability of the process, before I give the floor to Ruan, I would like to leave you with the words of my colleague Isabel. She's a wellness advocate. If we can manage to play the video, Isabel will tell you what the role of the wellness advocates in supply division is.
Hello, my name is Isabel and I am a wellness advocate here at UNICEF. The Wellness Advocate program is part of UNICEF's wider well-being initiative. We are trained to look, listen, and link. This means looking for colleagues who may be in need of support, listening with empathy, and linking with the appropriate resources. Now, beyond this, we also have a role in the psychosocial risk management process. The way I see it in these early stages, as a wellness advocate, what I am trying to do is help our colleagues understand what a psychosocial risk is, make this concept more concrete and demystify the psychosocial label. In the end, this is an occupational health issue that is no different from physical health and safety. Now, this could involve things such as providing specific everyday examples to help our colleagues identify a psychosocial risk when they see it, when they experience it, or when it affects them. And it also helps them be aware and share what are the factors that affect them the most, so UNICEF can focus the efforts there. For me, being a wellness advocate is about building awareness, supporting dialogue, and creating a healthy work environment for all.
Good afternoon, colleagues, and good day to those online. I first want to maybe just say thanks to Paola next to me, because she often underestimates her work that she does, and UNICEF is very lucky to have her in the organization. She's been part of the discussions around psychosocial risk management since the inception of the UN taking it on board. So yeah, she's done a lot of research. She's engaged a lot of people in the work that she does, and part of the advocacy in UNICEF, we've really relied heavily on her support, as well as thanks to Duda for bringing it in into the UN system and giving us a big tool. Yeah, thank you. So just on yeah, thanks. Perfect. I've got this. Thank you. So on why we are actually deciding to scale it up now in UNICEF. We've realized, Thanos has spoken about the impact on productivity and the return on investment. None of this is really hypothetical. We've looked at all the data, and it's evident that the inaction around psychosocial risk management really has a significant impact at this point in time. In the UN, we've seen that the impact on sick leave is quite significant. We've seen 20% related mental health related sick leave. We've also seen quite a dramatic surge in cases of psychiatric disability, and understanding that currently with what the UN is going through, the system is heavily under pressure with the funding cuts, with the structural change, and with the staffing reductions. So understanding that it might seem a little bit too late, as Duna has said, but it is really the right time to scale it up now. We need to understand how the organization is going to settle, how the teams are going to settle, and how that can actually impact the service delivery positively from a psychosocial wellness perspective. Yeah, so for us, scaling at this point in time is not optional. It's really essential to protect our staff, to preserve trust, and to really maintain our mission delivery as well. For UNICEF, we decided we've done a lot of legwork with also thanks to Paola around the advocacy of bringing this to scale and scaling it up globally. And we have gotten the green light to do so, but we're decided together with management that we will start from 2026 towards the global scale up, looking at the SD model of how we did it, and trying to duplicate that on a larger scale, and as well try to look at the sustainability of the action planning and the interventions, because understanding that it's larger than the staff wellbeing team, and the implications of support is going to be needed. We would like to do it similarly. So just where do we go from here? I would propose that we look at three main priorities. We need to embed PSRM in the government's frameworks across the UN. We need to hold leaders accountable here. Organizational accountability is a must when it comes to psychosocial risk management. And from a perspective where we need to co-create psychosocial wellness with leaders, and understanding that buy-in will actually make a significant delivery in the results, especially results for children in UNICEF. Secondly, I think we also need to own it, like the leadership accountability, like I said, and thirdly, we need to scale it, but scale it systematically and sensibly. We need to roll it out with benchmarking, with digital dashboards, and integration with the future concept of the UN mental health and well-being strategy. We need the collaboration across entities and agencies to be able to do so, and that will actually help sustain the impact of the PSRM over the long run. So yeah, I think finally, just let me close. I think psychosocial risk is predictable, it's preventable, and it's measurable, but only when we treat it with the same seriousness as financial and physical risk. Leadership and organizational accountability, like I said, is not optional in this domain. The UN 2.0 vision calls for responsibility, accountability, and aligned incentives. But PSRM, in this instance, can give leadership that tool to do so. Yeah, together, I think the question is not if we should act, but to act now, and to understand that acting now is in the best interest of all the organizations and of all staff. So thank you.
Thank you, Paola. Thank you, Ruan, for such an interesting presentation. Another excellent example of why we need PSRM across organizations, and a proposal of how to sustain it and make it part of the institution as a whole. So thank you for that. It is about managing psychosocial risk and promoting mental health in times of change. And the presenters are Daniela Menes, Staff Welfare Officer, and Mira, Celin, HR Partner at the International Labour Organization, the place we are today. Thank you.
Thank you, Luis. Thank you very much, and hello to everyone here and online. So there is a bit difference in between the title that was just announced and what we have chosen to present this afternoon, but that's absolutely all right. Because as our HR director mentioned, we have now at ILO an ILO action plan on mental health and well-being. And recently our DG, as recommended by our Committee on Occupational Health and Safety, has decided to go ahead with a psychosocial risk assessment, which is a great news, really great news. We are happy about this. This is a recommendation from the Committee on Occupational Health and Safety, very much supported by the administration and the staff union alike. But before we get to this stage, we had to do a lot of groundwork. And for today, we thought it might be of interest to explain a bit what we have done in terms of auditing the policies, procedures, internal documents that we have that are accounting for the mental health and well-being of staff. So a bit of context for this, we were actually conducting or deciding to conduct such an exercise at a time where in the Committee of Occupational Health and Safety, we were discussing about the adoption of the UN Mental Health and Wellbeing Strategy. In fact, ILO has adopted the UN strategy already in 2018. But we were still debating with different key stakeholders in-house how we can actually translate the strategy into action. What do we need? I mean, we are ILO, we have a special DNA, we are not UN Secretariat. So what do we need? So the discussions were ongoing with the working group on mental health and well-being of COSH, a group that was benefiting from experience and advice and expertise from OSH colleagues, from the medical advisor, from our OSH coordinator, from HR, and from the staff union. So thanks to support and some funding, not probably as significant as the one that UNHCR got from the German government, still with some funding in-house, we actually hired an external consultant to review our 475 active office procedures, official documents that were then active at that time. So it was an exercise that we conducted in the middle of the COVID, 2021, 2022. I want to stress that we didn't start from zero, right? We realized through this exercise that ILO had already very strong elements related to occupational safety and health principles in their policies, internal policies. But the working group from COSH felt that we have to do something in terms of revision of what it is available to staff, simply to bring to light and to put the spotlight on the psychosocial dimension. We do talk in the current, or let's say in the more traditional OSH framework, about health hazards and risks, about safety hazards and risks, but we don't talk that much about psychosocial risks. I think this has been said already by the other intervenants. So moving forward, what do we wanted to achieve? We wanted to see how many of those policies, office procedures, official documents were addressing the factors, the psychosocial risk factors, and how are the risk and protective factors reflected in those documents. So for us at that time, remember it was 2021, 2022, we didn't yet have the second iteration of the UN strategy, and the WHO ILO policy document on mental health at work wasn't yet out, right? So our framework was the 2018 strategy, UN strategy, our internal recommendation from our joint negotiation committee working group. We had 8 recommendations there. Also, the ILO stress prevention at work checkpoints. My colleagues from ILO, especially those from the OSH department, are very much familiar with that document. And also the SOLVE training package. So looking at the dimensions of the psychosocial risks, we have chosen to simply show to you 1 or 2 of those and how we did actually go with this exercise. So looking at the workload and management or job design, what we found is that ILO actually indeed was addressing this through a number of procedures, policies, or internal documents, right? We do have project management policies, we have job descriptions, job responsibilities, we have result-based management of projects, etc. The same goes for physical environment. We have OSH in the office, we have measures for safety and security, we have IT devices policy, etc. For good lifestyle promotion, we have, I would say, quite modest provisions. We have an ILO no smoking policy and something around alcohol in the workplace. So I'm not going to go over all those dimensions. Those dimensions probably you are very much familiar with, those 13 psychosocial risks. But what is probably more of interest for our conversation today are the gaps that we identified. Remember, this is an exercise that took place 2021-22. So social connection and support, we could do better. Job security, but who does not have that gap currently in their workplace? Promotion of health lifestyle, we can also improve and do different things to support the promotion of a healthy lifestyle. Support for high stress duty stations. Well, there is an explanation for that. We don't have the same mandate. We don't have the same field footprint as our colleagues from UNHCR and WFP or UNICEF. However, ILO has more and more staff working in what we call fragile states and difficult duty stations. And now with the world, with this multiple crises, we are also exposed to the same risks as other colleagues who are based in high stress duty stations. Work-life balance is also an area where we can propose things to support a better work-life balance. And we found also that there are concerns around stigma related to mental health and accessibility of services, especially for those colleagues that are based in the field. And then a need for monitoring and evaluation. So to link up a bit those findings with the gaps, what did we do with that? So we come up with few recommendations. I'm going to give you just a few examples. And what we actually did concretely to implement. So for the social connection and support, we recommended through this COSH working group to expand the mentoring for onboarding staff. So currently we do have a mentoring scheme at ILO. Also to implement the peer support volunteer program, something that my colleagues from the UN, my counterparts, are very familiar with. At ILO, there was no such a system. We have now one, I would say, modest network for Africa region. Promotion of a healthy lifestyle. So I mentioned to you what are the gaps. What did we recommend is to introduce the mental health training and recognition programs, to encourage initiatives for better sleep, nutrition, exercise, and develop resources for psychological first aid. So we have done a few of those already. We have implemented a few of those measures. However, for the mental health training, for instance, we still have, I would say, persisting need to improve the, I would say, knowledge, skills among our managers to be able indeed to address the concerns related to mental health and well-being of their teams and individual staff members. Just before I pass on the floor to my colleague, Mira, just to say that this exercise was really highlighting for us the need to address those issues in a very comprehensive manner. It highlighted also that we are not starting from scratch, as I said, but it also highlighted that this needs to be done and conducted in a more sustainable manner with a tool that will really allow us, right, to identify what are the priorities in terms of managing the psychosocial risks, and what exactly are the resources needed for that. Also, a second, I would say, major conclusion after this exercise is that we absolutely need to include the psychosocial risks in our risk register. ILO does have a risk register. We do have an enterprise risk management system in place that does not account for the psychosocial risks. And really last comment, it's about the importance of having really engagement support from various functions within the house. This is not a staff welfare office, solely a staff welfare office issue. It is an organizational concern, and different functions have to contribute to this effort to implement the assessment, to run the assessment, and then also implement the measures to mitigate, reduce, manage the psychosocial risks. Thank you.
Yeah, so maybe we should have had this presentation the first ones, because we are at the basis here. You know, we haven't started our psychosocial risk assessment yet, but this is our plan, as Daniela said, and Danielle as well before. So we have actually introduced our ILO action plan that is actually running out by the end of the year already. And in our plan, one of the main pillars was also to carry out this psychosocial risk assessment that we are planning to do in the coming months. As well, of course, we have done a lot on the promotion on access to services, because of course this was one of the main things that we wanted to have, because we have many services, as Daniela said, in-house, and we have seen actually that many of the colleagues don't know this. So this is what was important, to really, you know, publicize that we have the services that are available for our colleagues to come. And then, of course, we have done many other things. We have done recently also a stigma reduction campaign. You know, this is also one of the elements of the UN mental health strategy. And we have been working on that and have done a 1-week stigma reduction and program, let's say, in May. But it also addressed other elements of well-being because of the situation that we are facing right now. So what we wanted to share with you today as well, because this was one of the hallmarks in ILO action plan, is also the manager education and training, because we have done a lot on that, and we are actually even thinking that this will be one of the mitigative measures once we come to that. But definitely, I think, you know, it's important that mental health and well-being are actually mainstreamed in all the training and development programs, and this is what we try to do during the past few years. So it's not only that we mainstream this training, the mental health and well-being in the trainings, but also we try to evaluate, you know, all the sessions by the participants, so that we actually ensure that feedback is incorporated in future sessions. So just a few examples of training that we are having: effective performance management, for example, but this is always, you know, we have also the staff welfare officer as the resource person there. For example, maximizing field office performance workshop, etc. So other things that we are doing, we are now incorporating, as Daniela said as well, but also in the orientation workshop for new officials, we have leading hybrid teams workshop. So all these things, we are always thinking of the mental health dimension that we need to incorporate there. So yes, we have done quite a lot in that part as well. And so the next slide, maybe. So the other thing that we also included actually as a result of our action plan is that one of the measure of performance of our managers and one of the outputs is also the mental health dimension. So we are saying that our managers need to be evaluated on that as well. And then also in managers' upward feedback, we are including this dimension. So yeah, we are trying to already work on this, and we are sure that with the psychosocial risk assessment that we will do very shortly, and then the mitigation measures that we will incorporate later on, that this will be just more tailor-made, and yeah, will ensure that, you know, the change culture that Duda was talking about would also happen in the ILO, despite these difficult times that we are all living these days.
Thank you, Daniela and Mira, for such an interesting presentation. I actually think that this is a good way of finishing and closing the session, because many of the colleagues here are just starting to the process. They're just thinking of how to do it, and I think this is actually a good way for you to relate to that particular starting point. And then you have two amazing other experiences or processes that have been started and they are actually quite well advanced with proposals on how to sustain it in time and how to make it part of the institutional processes. So thank you for that. Now we have some minutes for questions. So we will start with the questions here in person, and then I will read any question if we have any questions online. So please, I open the floor for questions.
Thank you. Hi, everybody. My name is Samar Haidar. I'm here for the UNICEF, which is a federation of staff unions within the UN system. And I mean, this is a question that I've been wondering about since this morning, and I'd like to ask something like a little bit more concrete, because in all what I've heard, so in terms of risks, some risks are like obvious and they're blockbusters. So for example, if you're overworked, if you are so overworked that you cannot take leave or sleep properly, or if there's like a big trauma, those are like kind of straightforward things. But then there's sort of the more, let's say, perhaps culturally or personality driven things and more interpersonal things. And those are also very prevalent and very frequent. And we see a lot of that as unions. And frankly, I mean, it's not something that, I mean, it's not our job to deal with it, but it's also very hard to sort of navigate, if only intellectually, sort of try and make sense of the situation as a union. And my question is, for this subset of issues, I'll try to articulate, what is your regulative standard? Because, I mean, surely it cannot just be that someone is feeling bad. That would be, you know, it's just that if I mean, of course, everybody's experience is valuable and valid, but then when people go to you, for example, and most of you are counselors, and they tell you a story, and they tell you what's wrong, what is the standard that is in your mind in general? Let's say for something that's related to, I don't know, performance or some, you know, interpersonal, what is this thing that staff management relation or the relationship between staff and manager should be that you refer to? Because honestly, I mean, it's not infrequent that we get like the two people at the two ends coming to the union at the same time. I mean, just sorry.
Just maybe I'll start, and good to see you again. Maybe just kind of like to put this question in the context of psychosocial risk management. That is one of the psychosocial risks that is measured. So that is one thing that is already important. That is not exactly what you asked to the end, so I'll come to that. But what I wanted to say is that when that first of all, in the context of UNHCR pilot, for example, that was the risk that came the very last. It had the smallest impact on the outcomes. However, we actually had a discussion a little bit about that, because it's a factor, it's a aspect of work environment which is so embedded in the code of conduct, etc., etc. We are still actually telling operations you need to discuss this, no matter how small that risk is. Now, in the context of addressing the risk itself, and I'm still on the systemic issue, because that is what we need to address, not just individual, that is where we have the possibility to say and to unpack a little bit of why is that happening in our operation or in our team, etc. What could help? What do we need to happen to help? And including maybe answering the question on the standard. So to answer now more concretely, to attempt to answer more concretely your actual question of what is in my head when I have somebody talking to me as a counselor about it's about their interpersonal issue or feeling disrespected or being in conflict or anything like that, right? To me, it's maybe it's a little bit of different paradigm. I'm not problem solving for this person, right? I'm doing whatever I can to make them feel heard, and to create a sense of psychological safety for them so they can actually move forward and seeing what options do they want to take. So that's maybe a little bit different answer than you expected, but I think what you are saying is extremely valuable in the context of the PSRM, and I would bring it back to that, because I think that is where that discussion needs to take place. Mike.
I saw that it was last, but I think that when it deteriorates, it probably shows up, for example, in career development, because if people feel stuck, or so it might be not fundamental enough, and this might explain why it's last.
And this is why also we do think it is important actually to keep it present, and to keep it actually present in the discussions going forward, because we do want to have respectful environment. So I don't, maybe you have more.
Just maybe to add, I think the value of the PSRM lies also in the communication of the individuals who's engaged in that team, and understanding that we each bring our own perceptual filters of how we view the world and how we see an issue and how we see a problem to the table, and having that space for communication, understanding these different experiences could lead to better solutions on all of those. And like you said, it could be integrated potentially in career management, and someone doesn't necessarily see it that way. So I think having those discussions is where the value lies. Yeah.
Thank you for that. We have another question at the back. Just you? Yes. Thank you.
So I have two questions, one for Duda and one for Paola. Question for Duda, maybe a bit of context. As physicians, when we read a study, we always like to see results with a clinical impact. And when I read all your PSRM, something popped in my mind. It's the fact that maybe people from the EAOHP know about that, but occupational physicians, they often research on themselves. And there's been a lot of studies on either emergency physicians and healthcare professionals, or intensive care. And the ultimate goal is to prevent poor mental health in healthcare workers, because it saves lives. Because healthcare workers with poor mental health, they provide lower healthcare, and so people die. I think this kind of idea could be implemented in UNHCR, because I think that people working with refugees, if they have lower mental health, maybe people die more. I'm sorry to be that straightforward. That's a comment more than a question. The question is for Paola. What are the credentials of the wellness advocates?
Maybe just quick response to the comment. Indeed, we do want to look at the functional groups. And I didn't mention, but we have managed to connect the data that is collected through the questionnaire with the organizational data, right? So through that, we have the opportunity to eventually come through the filtering to seeing the differences between different groups. This very project started with trying to do something for colleagues that Zaina represents. This is refugee status determination or resettlement colleagues who are typically on a day in, day out, listening, interviewing, and hearing, exposed to very, very traumatic context. So we did make our observations, and we wanted to make a tool for their management to do something with that. We went much broader, but absolutely, you're spot on, this can be used for that.
And this is a great way to sell the whole initiative to management.
credentials of the wellness advocate. So I can tell you what the procedure for selection of the wellness advocate has been. So we had a call for volunteers. Everybody had to write a letter of motivation with their qualifications in it. I'm telling you, I probably have been selected more lightly than the wellness advocates. They have, we could select because a lot of colleagues in supply division are incredibly qualified. So I have a lot of coaches, for example, on my hands in supply division, just because they're there, and on top of being a procurement assistant, they're also a coach. Isabel, who's the one you saw in the video, she has also OSH qualifications. So we try to select the wellness advocates starting from their qualifications and from the fact that they were either staff representative or people and culture, or trained in some form of manner in something related to mental health, so that they were coaches, that they were, some people had well-being courses, some people had been PSVs before, peer support volunteers. And then all of them had gone, supply division paid for their certification as mental health first aiders. So they also have that.
Thank you for that. We have a couple of minutes for one more question. I think you have a question. Thank you.
Thank you very much. Good afternoon. My name is Daniela Glez. I'm from Eurocad, which is a trade union organizing managers and professionals. I have two questions. First one on the PSR management tool, which is a very interesting tool. And I apologize if you explained this and I skipped this, but I have seen a suggested actions in one of the slides. And my question is, how did you elaborate this list of actions? Was this discussed with the workers themselves or with the managers, etc.? A second question I have, and I'll make it quick, for the ILO presentation. I have one remark, which is I really appreciated when you put the high stress duty stations as one of the factors there, because we have at the European level, we also follow up the European Federation of Journalists, and we heard many employers from the journalists saying that it's a part of the job. That's it. Nothing has to be done, especially when journalists go in areas where there's a lot of stress because of wars, etc. It's like nothing can be done against this, which is not what we think, of course. But one question I have for you is on the, you put that managers are evaluated on the well-being of the workers, one of the performance indicator. And this is a bit problematic for us representing professions and managers, because managers find themselves between a rock and a hard place, because they're not the ones that can provide the resources to prevent these risks. They're not part of the strategy sometimes of the companies or the organization, and it's puts them in a situation where they have to cope with the stress of the workers in their teams, but at the same time they don't have the means to prevent them. Thank you.
Yeah. Maybe very good comments. Let me respond to the manager comment first. So yeah, indeed, you know, during COVID, for example, we saw that actually the managers were the one who were the most impacted, together with the HR. So we definitely understand this, but at the same time, you could see actually the different types of managers, and you can see that some managers, despite having the same tools as the other managers, they do a lot for the well-being of their staff. So there are differences. And I think this is the part that we would like to evaluate. It's not necessarily, you know, of course they don't have, you know, means to impact everything. But I think there are some elements that indeed they could have a, you know, a say on. And we see this. We see this, especially as HR. I think my boss is there as well. Daniela, I think, can comment on that as well. So we see big differences in that sense. And we see also in the feedback that is provided that this is the case. So this is what we would like to address.
Yeah, thank you for this question. It's a very interesting one, and I think this is probably of interest to many of the service providers in the area of HR and counseling, because we, at least in our practice, we also support managers, because managers are staff members as anyone else. However, a manager has also not only the responsibility for the operations, the manager has the responsibility to look after the safety, security, and well-being of staff. So it's that notion of duty of care, right? So in the context of ILO, what we realized is that we must improve the knowledge, the skills of our managers to be able to discharge properly that duty of care that they have, the responsibility of duty of care. And there are different ways to do that. Psychosocial risk assessment is one of the things, I think, is the basis, because then it would highlight what it is exactly that those managers have as a toolbox, right, in the house, in the workplace, and what it is missing, what it is that we need to do to help them. For us, a very quick fix, let's say, during the COVID, because we were actually receiving a tsunami also of requests from the managers that didn't know how to absorb all the requests from the teams and the individual staff members, was to have trainings, ad hoc trainings on improving mental health and well-being in the workplace. And what the feedback that we got from those, it was a pilot training and then a series of trainings, was that they appreciate the information, they appreciate having basic skills and knowledge. What was really making a difference for them was the ability to peer learn, to exchange, peer learning among managers that are exposed to same challenges. So it is not only about skills and knowledge, it's also about community of managers, peer learning and peer support. Yeah? And the comment about duty stations is not that we have chosen or opted to do that. That's one of the gaps that actually emerged from our policy audit. And it's probably the organizations who have a heavy field presence can speak more about that, because indeed one of the measures that, despite the fact that we don't have a lot of people in the field, deep field, one of the measures we have decided to put in place is pre-departure resilience briefings with a staff welfare officer for those colleagues that are going to, for instance, we have right now a team in Ukraine. Yeah. So it is important to have those pre-departure resilience briefings as one of the buffers, right, as a measure to eventually anticipate any problems that they might have, or somehow reduce, right, the exposure to a certain set of risks. Thank you.
Thank you. Thank you.